You are welcome to my channel. Today I'll be addressing Lyme disease and effects of Lyme disease on the heart. But before now, I have a separate presentation on Lyme disease already published. Please check my channel for that. However, today, the journey from A to Z, how Lyme disease can affect the heart and what we need to do will be right here. So enjoy listening. There is a small brief advice here. If you take it, that's fine. And that is, don't allow the tick to bite you. Why that? Years after, you may be paying for that bite. Epidemiologically, male to female ratio is 3:1. The rate would decrease with increase in antibiotic use or proper Lyme disease treatment. It affects the heart when the inflammatory process spreads to the heart. This disease was just discovered in 1982. It is a vector-borne disease transmitted by ixodes. Ixodes are hard-bodied ticks. The causative agent is a bacteria belonging to the group of Spirochaete, and the specific name is Borrelia burgdorferi. It's very common in North America, that is USA and Canada. The ixodes is very friendly, and they are very friendly with small rodents like mice. And the mice will serve as primary reservoir, while the main host will remain dead. Human beings are bugged by this tick. When? Unfortunately, this will happen at the time of enjoyment in summer. And where would that happen? It will happen in wooded areas. How can we prevent this preventable disease? Don't visit the domain of the ixodes tick, period. But if you must take the risk, then wear long sleeves and long and thick pants that the tick can't penetrate. In addition to that, you may go with tick repellent. Apply that on your skin. You can grab permethrin on your clothing and physically look for, and if you're able to find, remove any tick after your arrival from their habitat. You can bathe. That would be great. Wash your clothes in washing machine and dry with a very high heat. Why that? Just to kill any other hidden tick or ticks. You may decide to spray pesticides on the habitat. But the best advice is don't visit the domain of the ticks. If peradventure you have been inadvertently bitten by these ticks, you have prophylaxis. Not the end of the world yet. Grab doxycycline. Immediately you notice that. But you are not the one to do that. You go to your doctor, and the doctor will prescribe doxycycline for prophylaxis. But it's not everyone that could take doxycycline. Anyone less than 8 years and not pregnant women cannot take doxycycline. Okay, how do we make the diagnosis of Lyme disease affecting your heart? Okay, the clinical features of Lyme disease generally already published on my channel. You can check out for that. Then, bradycardia on physical examination, AV block as will be revealed by EKG. And remember, I will say this repeatedly in the course of this presentation, that no permanent pacemaker in Lyme-carditis. Still on diagnosis, Basically, from the onset, you can have Lyme serology, and you adopt or employ enzyme-linked immunosorbate assay. And after that, you can confirm the diagnosis with Western blot. IgM will reveal early infection. IgG will show up after weeks. Remember, antibodies may remain even after your good treatment. So, the fact that you are picking the antibodies right now is not an indication that the disease is still fresh. Even after treatment, antibodies may remain for a long period of time. Okay, now Lyme disease and the heart. EKG or ECG will be required here. Chest X-ray will be required. Echo will be required. And you can enter lab to have complete blood count and electrolytes. Now, stages of Lyme disease. The reason is that if you are bitten by Azodes tick today, it doesn't mean you are going to come down with all the features that I've mentioned and that I will still mention immediately today or tomorrow. No. All these things will be in stages. So the first 2 weeks after tick's bite, you'll be dealing with erythema migrans, non-pruritic bull's-eye that will have red with clear center that is necrotic, and that will be found in the thigh, exposed area, and sometimes in the hidden regions of the body like the axilla. 2 months after being bitten by the Azodes ticks, there might be meningitis with cranial nerve pulses like cranial nerve 7, that is facial nerve palsy, peripheral neuritis, cerebrospinal fluid assay can confirm with the aid of antibodies that there's Borrelia burgdorferi. It could be associated with headache, fatigue, paresthesia, or mild nerve stiffness. Myocarditis or transient heart blockage as first degree or second degree or third degree may occur, that is after 2 months. After several months to years, there might be chronic arthritis in a joint or may involve more than one joint. Acrodermatitis, chronicum atrophications can occur. There may be neuropathy, meningitis, or encephalopathy. The cardiac involvement could vary. There might be pericarditis, myocarditis, AV block that may be mostly short-lived, but sometimes in small percentage of patients could become permanent. There might be cardiomyopathy or left ventricular heart failure. With carditis, what are the possible clinical features? It might be asymptomatic, and when there are symptoms, could vary from light-headedness to shortness of breath, to syncope, to palpitations, chest pain, dizziness, dyspnea, cardiac arrest, and sometimes sudden cardiac death. Treatment, specifically when it comes to AV node blockage. Once we are suspicious that there is AV blockage, then we have to hospitalize. Let EKG be done, or ECG depending on where you are, right? Go for the PR. Is it greater than 300 milliseconds? Oh, here we go. There's a problem. Hook up the vital signs machine, please, with telemetry running. Then grab your intravenous antibiotics, Ceftriaxone, Cefotaxime, Penicillin G, depending on the protocol where you are. You may stop that intravenous antibiotics when the EKG is giving you the features that the PR is now less than 300 milliseconds. That depends on the protocol where you are anyway. You can begin your per-oral medications. And sometimes you may use only per-oral medications if the affected individual is asymptomatic. The issue of pacemaker should be well addressed because I said AV blockage will be first degree, second degree, or third degree, but related to Lyme disease. If that is the case, we are not looking for permanent pacemakers here. So, Lyme disease with AV blockage, we need only temporary pacemakers. That will be welcome if the AV blockage is symptomatic. And even when we welcome the temporary pacemakers, that will only be used for a few days. Permanent pacemakers are not welcome, but we are not ruling it out. It can be used when the cardiologist, again, let me reiterate, the cardiologist would have determined that this is a permanent AV blockage, or this has degenerated to permanent AV blockage. Then permanent pacemaker could be used. So permanent AV blockage, permanent pacemaker, determined by the cardiologist. When you have treated the Lyme disease adequately and there are no more concerning symptoms and the EKG is also confirming that the AV blockage is no longer a threat to the life of this individual, with the help of your cardiologist, then you can stop the temporary pacemaker that you have adopted. In Lyme disease, you don't need permanent pacemaker unless in few percentage we will have permanent AV blockage. Treatment generally, like if you have gone through my first presentation on Lyme disease, will include in the early part of the disease, you can use Evrozine, doxycycline, or Mosil for 14 to 28 days. If there are neurological signs and symptoms, you can use intravenous Ceftriaxone with doxycycline for 14 to 28 days. If cardiac involvement is the issue, just like I've gone through at length, either first degree, second degree, or third degree heart blockage, can use your Ceftriaxone with doxycycline. Generally, you may choose from Ceftriaxone intravenously, Amoxicillin per oral, doxycycline per oral, or Evrozine. Prognosis. Lyme disease having effects on any part of the body generally will have good prognosis most of the time. But we expect the resolution to occur within 1 to 2 weeks. It may hang around for 6 weeks. A tiny fraction may have permanent AV blockage. The situation will be worse when there is AV blockage with Wolff-Parkinson-White syndrome. Also, the situation would not be so good if there's AV blockage with cardiomyopathy or AV blockage with heart failure. In all those cases, it will be bad prognosis. In short, the prognosis is dependent on the associated comorbidities. In conclusion, ask about the prevalency of Lyme disease, or the prevalence of Azodis tick before going to that resort on vacation. Find out. That will help you. Instead of spending your money to buy what will kill you. Have fun. Enjoy yourself. But don't come back home with tick bites. With that, I've come to the end of this very presentation. Remember that I published one earlier. You can check my channel for that. Remember to share this very one. This is the one going into details of how Lyme disease can destroy your heart and what should be done. Thanks for listening. Remember to subscribe as well so that you can get this presentation and many more immediately they are published. I appreciate it.